Hello, I'm Dr. Edward Despott, and I'm a consultant gastroenterologist and interventional endoscopist at the Royal Free. I also hold a position of honorary associate professor at University College London, and my main subspecialism is really interventional endoscopy. So the removal of polyps and early cancers by minimally invasive means endoscopically. I also specialize in small bowel endoscopy, which allows us to look and treat the small bowel in a minimally invasive way using capsule endoscopy and double balloon enteroscopy. And I also specialize in other minimally invasive techniques such as transnasal endoscopy and, of course, all the other types of endoscopy such as an upper GI endoscopy and colonoscopies, looking for polyps and removing them. So I chose to become a doctor because it is one of the very few, I think the only one in its rank that allows us to use our profession to really help people. I always was fond of science, and medicine was the natural thing for me because it allows us to use science in order to help other individuals. I was fortunate enough to then be exposed to gastroenterology and endoscopy, and I found it very much my target specialization, because it allows us to not only use science and medicine to treat patients in the conventional way, but it also allows us to actually do things manually and through instruments called endoscopes, which are camera-based instruments. We're able to minimally invasively treat conditions such as polyps or areas of bleeding or areas of narrowing in the bowel with much benefit and avoidance of surgery in many a time. I was fortunate enough to also dive deep into my specialization. So I took 3.5 years dedicated training in advanced endoscopy at St. Mark's Hospital. I also ventured to Japan for over 5 times. In fact, all my current mentors are Japanese, the inventors of double balloon enteroscopy, for example, and endoscopic submucosal dissection. And I really took it through to higher levels in academia. We publish guidelines for the European Society. I hold positions with the World Endoscopy Organization, and I'm also the senior associate editor for the American journal Video GIE, which is one of the flagship journals of the American Society. So yes, I'm very happy that I chose this specialty, because it really allows us to combine medicine and science and also intervention for minimally invasive care. So that was my route. So I really try to explain things in the simplest way to patients. I tend to use analogies in order to make something very complex relatively simple for the patient to understand. I am very empathic because I was through my life, I passed through several things with my father suffering from cancer, so I can understand it from the other side of the spectrum, as it were, on the other side of the fence. So I try to see it from the patient's eyes, and I really put every effort in order not only to help the patient medically and with my skill set in interventional endoscopy, but also from the human side, from the empathic side. I really try to go through the patient's journey together with them and support them.